Well, greetings again. This is Dr. Bill Wyatt, and I'm with the American Orthodontic Society. And I'm a little put out with my organization, the American Orthodontic Society, and I helped start this thing 50 years ago, and I have worked on it for all this time, and for years I lectured all over the United States and parts of Canada and Mexico and Ireland and different places in the world. I even went to Dubai for 10 days and lectured there with a lot of the people there from that country. And I have covered everything I could think about in orthodontics, from even before birth till after, till you're dead. You can move your teeth. And I have said, and I'm still standing behind it, there's not a movement of teeth or groups of teeth that we can't do with what we're calling the straight-wise orthodontics. And so I don't have much longer to work with people, and I want this to be the way orthodontics is done. It should be like the rest of the specialties in dentistry. If you're an old surgeon, you don't get all tore up if somebody takes out a wisdom tooth or does something to trim the bone, to put some immediate dentures in or something like that, things that they're used to doing. And that's the way orthodontics ought to be. But the universities are not teaching you or teaching the people they turn out to do this adult orthodontics, the tough stuff. And I'm going to show you a case here that I consider a tough case, and I'll show you what we normally would do on a case where we want to expand the arches of adults and stuff. You take, for instance, a person is a mouth breather. In other words, he breathing through his mouth, and there's no way you can keep him having your tongue in your bottom arch when you're breathing through your mouth. And if you're a chronic mouth breather, your tongue will spread the lower arch out, and it won't develop the upper arch like it should be. And that's what this case is kind of like that. And in his particular case, let me get back onto this case now and show you what we are doing. And there's several things wrong here. And you've got to take each problem that person has and treat that and conquer that problem. And if you get all of the problems and you get them straight, they tend to stay straight. But if you leave one or two of the things you haven't done, you'll have to wear retention for indefinitely. And retention is a hard thing for people to understand. There's a lot more to it. In most of these cases, these young people, they have to wear a retainer for a few months, and then maybe at night for a while, and that's not the way to retain teeth. You've got to work at every problem that person had that made their teeth go crooked. And so you have to conquer all of that, and then they tend to stay straightened. So I'm going to go right over to this guy, and this is a difficult case. I say made easy. It's not easy to do it, and I think this case scares everybody to death. But this is what orthodontics ought to be doing. The university-trained people should be taught to do this tough stuff and let people know what can be done. And if some of them want to do minor things, welcome them to do that. Don't condemn them for getting over into orthodontics. And the pediatric dentists ought to be doing their own orthodontics in their early ages. I've gone through some, probably 20 or 30 things that you could do that need to be done while it's happening in kids. All right, here's this, that was mostly, but here is this young man. I say young man, he's about 50 years old. And I don't know, I got to know him real good doing this case. Now here's somebody that is worse than nearly anybody you run onto. His total upper arch fits inside his lower arch. Now that scares people. They think, well, I can't do this, but you can do it. And I'm going to try to show you how to take this apart and do it in sections, and so you can figure out how to do it. Now these are his upper teeth. That's, you just see a little bit of his lower teeth now are on the outside of the upper teeth, right opposite from what they should be. The upper teeth go down to here somewhere like that. Now, he is forcing his jaw forward, so his temporomandibular joint weren't bothering him all that much, because he's keeping the mandible forward and the head of the condyle, which is way back up in here, something like this, and this is the fossa, and the ear is in this area, and it's keeping it back and holding this thing forward. So he didn't have any trouble with his jaw joint right here. So the upper teeth were keeping the lower jaw in a forward direction here. Now, how are we going to approach this thing? We've got to open the bite, and we're going to have to put a pad. Now, I really you could have put the pad on the inside of the lower teeth, but I put it on the outside of the upper teeth. Now this guy, looking at it on that side, see all the lower arch is out over the upper arch right there. That's on the right side. Now, when he opens his mouth, and you open here, he's wore these teeth down till they've ground down to a sharp edge. You can almost bite your finger into there. And when I put this right here, and it's got a big gap in this area. Now, if I could have put the stuff on the lower arch, or I came in and put it on the upper arch too, just these 4 teeth across here. You see, he could close like that, and I believe he could bite your finger off. Now the lower teeth are lined up pretty good. He doesn't have too big of a problem down here. You got to turn this tooth around, turn this around, and a few rotations, get things lined up like that. Now the upper arch, he's missing teeth in here and missing a tooth over on this side, right in that area. So when we go to, now this is the lower teeth are out in front of this. We've got to open the bite first. And so we put that pad on the teeth, and when it closes down, it stops. I've got a picture of the pad here somewhere. Okay, here it is. Now, it would have been a little nicer if I had put the pad on the bottom. You wouldn't have seen it so much. And the only gripe he was talking about was he couldn't eat anything. Now you see that space was about twice as much, and he's biting together on this every time he swallows. And that's pushing these teeth up, pushing these down. It's pushing these teeth are free. They don't touch anything. So they are going down and these are going up. That's just a natural way for teeth to do. And you watch this, he will come in, and when we go to widen this out, see, we put an intruding arch here. This goes up and you pull it down, hook it, it starts raising these teeth, pushes this down, and then it makes this come down, and he's chewing on that. He stops that form. Now, all right, this has been going now for a few months, and we've got, these teeth are almost together. He could eat down here now. At one time, these teeth, and now at this time, we're expanding the upper arch, and we're trying to make those teeth go against the bone structure up above to widen them out equally with the crowns. Now we've come in and we'll put a large arch in there and expand it some more. I'm gonna just make a deal here and show you how the better way to do that is, like if you've got upper teeth here and your lower teeth coming in like that, and it should be reverse of that, and on both sides of his mouth, that's the way it is. So I'm going to let this represent the teeth, and the lower teeth are sitting out like this. Now, I want these teeth up here are in between cancellous bone and soft bone. Now the cancellous bone is soft, it's spongy. And there's a cortical bone around the teeth going up like that. And we want these teeth to move out. We're going to expand that arch. So we have to put root torque, a progressive root torque in the upper teeth to make these teeth try to move over here. And this is the cancellous bone. I mean the cortical bone, which is very hard. All right. If you put this, you have to put progressive torque in the wire. You catch the wire right behind the cuspid, and you come down and you put the torque in it, and you get down over here, it's 90 degrees, and you twist that wire, and you've got a little place. You twist that wire, put it in there, and it's tending to push that root over there. Now, it's the same thing on the other side. If you did not put something to support it, this torque in the wire here will overpower the crown in this part of the tooth. It will make the crown want to go in this direction. It'll rotate somewhere around in there. And so you have to back that up. And that's the way we come in here with a real heavy, say an 014 of 4,000 or a 36,000 wire, and we expand that thing, and it's got all kinds of, and you put one, you push that together, it may take 5 or 6 ounces of force to get that to come in. You put one side over the other one over here. You take a Dontrix gauge and you go in there with a Dontrix gauge. I don't know whether you can see this or not, but this is a Doctrix gauge right here. Push on that, and it'll measure up to 1 pound of force on that, and you can tell exactly how much you're doing that. Now, if this is right behind the cuspid, you take the arch wire that's fat and you twist it at the end, and it does like that. Now it's 90 degrees at least, and you put it in that groove. You put the wire in there after it, like this, and you bend it up, but you don't bend it permanently. It just, that wire wants to come back, so it's pushing the roots out. And if you don't come in with this, the crown will move in. That's hard to get across to people. I don't think, and we do exactly the same thing over on this side of the mouth with the arch wire. So we're going to try to take these roots here and go out, and that cancel it. I mean, that cortical bone is like that. It's real hard. So we put that on there, and we pull this large wire in and tie it to that. And so this should go out, roots go out, and the crown goes out, and keep it the same way. So now you're going to try to develop that tooth out. I'm sorry, I hit something wrong here. Anyway, I hit the wrong button in there, and so it erased what I have put up there. But let me draw it right quick again. All right, we got teeth like this, and the bottom arch out here. Same thing over here, and the bottom arch here, and we want this to move out, and we want the crown to move out too. So we come in and pull this large wire up here. It won't let this tooth go in. It carries it out, it carries this. And you can watch the tooth go out there. If this crown starts to tilt up this way, then you've got too much force here. You need to add some here or reduce this so that the tooth will end up with it kind of like that, with the roots going out in that fashion. And that's what you can excuse my drawing, that's not like it really is, but that's, you're going to expand that, and you're going to expand this too. And it puts that same force over on both sides of that, and this large wire will spread it out. Now, I've said this straight wire system that we have, there's not a position or a place that you can't move with the teeth. Everything anybody's come up with, you can go and take care of it from the cradle to the grave. You can do that type of work. And this is why we do this. Now, if we had to do it on one side only, you can do that. I'm going to show you in a minute how we do that. Now let's go ahead and get on this stuff. Now down on the bottom, you see we got this tied up here, and it's coming around, and we pull that around and hook it to this bracket, and it'll spin that tooth. And it'll spin this one too. You see this little deal here. It's going to grab this bracket, not over the arch bar. It'll turn anything walking or breathing that's alive. You can rotate it like that. So we straighten the bottom out like that. And then we expanded the upper teeth, and we use this to raise these, and we've had this bent down so that it's taking the lower teeth down too. And these teeth will grow together while you're doing that, and the crown doesn't change. All right, we get it down about like that, and he's able to chew it now. So we had to come in and put some artificial teeth in that space right there. Now this is adult orthodontics, and there is a ton of this. See, these teeth are almost straightened out now down here. There's just oodles of people like that, and people have money to pay for it now. A lot of them would be happy to if they could have their teeth done like that. And so we put this, and now they've got it leveled out, and he eats on this out here, and these he can chew on them now, and he's happy to do that. Now we open that space up, and we're going to put some artificial teeth in those spaces. And we widen that out, and here's your big arch. You see expanding that upper jaw. Now that large wire will go there. We open this up. We're going to put some teeth on it. We've got this just about straight down here. That's not completely done. All right, here's your big wire that's carrying the whole thing out. And now the facial structure has looked pretty normal there. Now his upper teeth are over the lower teeth, like that. And this guy's about 50 years old, something around there. We stuck a artificial tooth here and some over there on that side. And he had some bridge work done later on. Now we've finished it up that far. Now we put 2 teeth over here to fill that up. And I think 1 on the other side. Now these have straightened out pretty good going in here. All right, now we've finished the upper, and we put a retainer in there, and the retainer has some artificial teeth on it, holding this out. There's 1 and there's 2 over on this side. Now we open that up. Now there's where he was when we started. And you see these teeth right here. So we didn't have to go down much with these. We went up with these over here. So there we have finished that. And I think these are bridges that he's got in here. He was griping about having to pay more for the bridges than he did to do the orthodontics. But that's the way it was, and there's the way it ended up, like that. Now there he is with the crowns and the bridges that he had put in. Now here's the guy's smile now. And that's what it was like when we started. We pulled those up. He had a crown on a tooth here, and we didn't want to mess it up, so we just leaned that one over and put it on there, and we filled this in with a tooth. His TMJ never gave him any trouble while he was going through this procedure. And here he is a few years later. It's filled out like that, and these teeth are closing in. Now this is adult orthodontics. This tooth was so wide on the bottom, we let it stay out. You can see it right back here. And this is adult orthodontics. This is the kind of orthodontics that should be done by the university-trained people. Let them do the tough stuff. And if they want to charge whatever, I mean, people would pay $25,000 or $30,000 or whatever to get their teeth straightened like that. There's really people like that. Now that's the way it ended up. And this what I've got in Straightwise Orthodontics. These are the type of cases. There's just a world of this out here that nobody is teaching this in the orthodontic schools. And people, I'm sure there's some orthodontists that have gone on and studied and worked and are doing this type of stuff. But in our own organization, the people are afraid to get on cases like this, and that just bothers me. And we have developed something that will help us do away with about 80 or 85% of the surgical double jaw surgeries. And we've got a case, I've got about 8 or 9 cases we've done like that. And one of them that we are real proud of has been done 37 years, and the lady's teeth are still just as nice as they were the day we finished. And so this is what I'm trying to get across during this 50 years. And the organization that I have worked with, the American Orthodontic Society, I think we've got one guy in there that's trying some of this tough stuff. And maybe there's other people that I don't know about. I would like them to write in about it and tell us what it is. But that went from that to that. Now, this tooth was so wide, I didn't want to bring this way out and stick it in, so we just let it stretch right back there. That was already crowned and in his mouth. That's the way it was. There it is after we finished it. The way that was. Now it's like that. So I hope you understand what we're doing here. And so I'm going to say goodbye on this case. We've got other tough cases, and we just did everything that came in. We didn't care. And so we have done some cases that these things are not taught now in many of the universities. I don't know of any that do teach this thing. So I'm going to say goodbye And I hope this will settle in on people. I don't mean to fuss at people doing the work, but I can't do it nowadays. And I'm on my way to 98 now, and just a month into it. And I don't think I'm going to make the birthday to these 98. But anyway, I've made it to 97, and I'm going to say goodbye, and I hope we can sell this idea to some manufacturer or something, and we are able to do all this type of orthodontics, and we've done it. We've got cases to show it, and I hope it'll catch on someday. Thank you now, and goodbye.